I'm just going to give this a few more minutes to make sure everybody is logged on time. We'll get started about 12:02. Alrighty, well, we'll go ahead and get started so we can stay on time here. We have a full agenda today, and I'm just going to kick us off and introduce who will be speaking, and then I'm going to hand the baton. So my name is Carly Solom. I'm on our Sanford Health Community Relations team, and we have a very packed agenda, as I said, to really bring good information to the people of Windom. There's been a lot of questions asked, a lot of anxiety about the COVID-19 situation, and wanted to have this platform to be able to give good information, quality information from trusted sources that you know. So agenda for today, we'll start with Dr. Dan Heineman. He's our Vice President over our network locations, so including Windom physicians. And then we'll also have Shelby Medina from the hospital, the Windom Area Hospital there. And then we'll also have Josh Sammons and Dr. Youssef on behalf of our Windom Clinic, Sanford Health Windom Clinic. And then Nancy Weplow will give a short little blurb about what's happening at our Good Samaritan Society there in Windom as well. And then Steve Nasby and city representatives will just give a quick blurb on where they're at with the city. And then we'll just have some time for a recap. Again, this is a big agenda, a lot of time. We will try to get to some questions at the end if there is time, but otherwise at the end I'll go over opportunities of how you can ask questions. So thank you all for joining, and if I could have you all make sure that you are muted. It does pick up a lot of feedback and background noise, so just making sure that you are muted. And with that, I will kick it off to Dr. Heineman to give us some great information.
Well, good afternoon, everybody, and thank you for joining us. As Carly introduced, my name is Dan Heineman. I'm a family medicine physician, and I'm currently the Vice President Medical Officer for the Sanford Health Network, which includes the Windom community and the Windom Clinic. And we want to talk to you a little bit about some of the basic facts of COVID-19. COVID-19 is the name of the disease that's caused by a coronavirus that's called SARS-CoV-2, and it's typically the symptoms are similar to what you might expect in an early cold or a respiratory infection or early onset of influenza. It's a dry cough, not very productive. You may get short of breath, and you'll have a fever, and that fever usually is above 100.4. You'll get some chills. With the chills, a lot of times you'll get some shakes, muscle ache, pain, regular sore throat. What's particularly interesting about this virus is it tends to cause a loss of taste or smell. And in rare occasions, that might be one of the earlier presenting symptoms. But most of the most of the time, individuals who are becoming ill with this virus have the usual type of respiratory infections. So who does this virus affect the most? The older you are, the more likely you are to have more serious complications from the infection. And that's true for lots of viral infections, but that it is particularly true for this one. The vast majority of people who have this virus have very mild symptoms. Some may not even think it's more than just a regular cold. A colleague of mine who's been ill with this or has now recovered said to me when I talked to him, he said, you know, if I didn't know better, I wouldn't have thought this was any worse than a common cold. But that was his particular course of illness. People who have chronic medical conditions, diabetes, heart failure, chronic lung disease, that are undergoing cancer therapy or have immune illnesses are at high risk. We're also understanding now that obesity may also be considered one of those complications for this illness. And the global mortality rates are higher than seasonal flu. And we may not know the exact global mortality rates until we have a lot more information, mainly because we're finding a lot more people who get this illness that aren't necessarily sick, and that could affect the global mortality rate. Because remember, rates are mathematical complications on how many people have the illness and what happens to them. So Carly, you want to run to the next slide there? So this virus is much like many other respiratory viruses. It's really spread person to person. And you have to have close contact. You need to be within a kind of an arm's length reach, your 2 arms length reach of somebody, about 6 feet. It's respiratory droplets. So it's from a cough. Those droplets then can settle on surfaces, and they then can be picked up by hands. And it's really about getting those droplets inhaled into your lungs, or they landing on what's called a mucous membrane. The lining of the nose, mouth, and your eyes are another big place where this virus can gain entry into your system, and then it typically goes and attacks the respiratory system. So contacts and close proximity to somebody who may be coughing and shedding the virus. So that's why the social or physical distancing is such a big part of how we can control this illness. And as we'll see on our next slide, what we've been trying to do for the last 2.5 months is, you hear this a lot, flatten that curve. Now, when you look at that curve, and if you look at the pink curve and you look at the yellow curve, the distance or the amount of color underneath the curves are probably pretty close to the same. But by flattening the curve, what we've done is we're not overwhelming the healthcare system. If we had the pink curve, we would be above the capacity of our hospitals to be able to manage the number of people that are coming to the hospital who need hospitalization and oxygen and possibly even a ventilator. But by flattening that curve, we still know that the vast majority of people in our communities are going to get exposed to this virus, but they will get exposed at a rate which will not overwhelm the healthcare system. So let's look at some numbers in terms of how we did some modeling. Now, this was a model that Sanford Health produced in March. And we're going to so the attack rate, about 80% of a population is going to get this illness. So we're going to use the number 5,000 because that's probably the Windom area population. Now, these were very aggressive numbers back in early March, and they've changed considerably in terms of, we've reduced some of these numbers and percentages now. But we know that 15% are going to be more symptomatic. Of that, about 15% are going to need hospitalizations. 25% of that number will need ICUs, and a significant number of the ICU patients are probably going to be on a ventilator. These numbers are changing a little bit as we understand the illness and the disease. Last evening, I got to be part of a phone call from a critical care physician in New Orleans who took care of a lot of patients. And it was interesting how the care of patients with COVID-19 has changed from early March to mid-May now in our understanding of how we can manage these patients and this disease. This is just one example of a model. I will tell you that this model has changed. We no longer think that there's going to be 16 out of those 5,000 patients that are going to be on a ventilator, maybe more like 4 or 5 that might need to be on a ventilator as we've gained some understanding of how this virus attacks and how we need to approach the care of those patients. So that gives you some basic information. I'm going to turn it over now to some others who are going to talk about how Windom and the Windom area is addressing getting prepared for this. And then I'll be available to answer any questions if we have time.
Good afternoon, everybody. I wanted to take this opportunity to just provide some information from Windom Area Health's perspective on what we've been doing during these past 2 to 3 months that we've been allowed to prepare in the event that we see an increase in the need to care for patients in our community. We started, I'll just give you some facts. First, we are licensed to care for 18. We have 18 licensed beds. So we are licensed to care for 18 patients, or we could max out at 18 patients, current state, even prior to COVID. We have submitted our surge plan to the Minnesota Department of Health to be able to convert some of our patient rooms and wings into COVID positive or COVID recovering wings and surge up to a capacity of 29. As we were also looking at our staffing needs as it relates to the potential of patients we could house, we did look at staffing skill sets, different staffing models to be able to provide adequate staffing to care for patients in the event that we did see hospitalizations of 18 or over, 18 beds or more of patients. We have worked with our anesthesiology surgery team, and we do now have a respiratory therapist here as well too, to start working on protocols for any type of patients that we may see that might need to have more respiratory management. We do have ventilators here. We do surgery here, so we have to have ventilators here as well. However, I want to stress that the intent isn't and never was where critical access hospitals were going to be expected to care for any COVID positive patient who needed ventilation or ICU care. Part of the planning of the state shutdown of the hospitals was to provide our hospitals again with the opportunity to plan for how we're going to care and manage these individuals. So we have worked with our tertiary hospitals and partners on what their surge plans are and what our ability to transfer to those hospitals are. So our plan would have been, we would have had the capability to manage any patient who needed vent care. We would stabilize them here in the hospital, and then our plan and intent would be to move them to a tertiary hospital where they are better equipped and better prepared to care for those types of patients. However, in the event, the rare event that we would have needed to manage that, we did have the resources and plan in place to be able to do that. We're also working with our community caregivers to really identify, in the event we did experience a surge, would they have staffing that we would be able to allocate to our hospital also to manage and take care of our patients. So really just looking at what do we have available for talent? What are those strengths? How can we reallocate those teams? And if we surged up to the maximum capacity, how would we be able to manage that? Again, we have plans in place for that. Looking also at PPE, we were fortunate as well too to reserve or find ways to preserve our PPE here within the hospital. We also worked with Minnesota Department of Health, the state, and also our Sanford partners to secure PPE that we thought we would need for the types of patients that we truly thought we would be caring for in the event of a surge. In addition to that, we did have a plan in place that we would be ready to implement in the event that we had staff or nursing staff who became ill with COVID-19. We had staffing agencies identified that were and working with Minnesota Department of Health as well too to waive licensures to be able to get some of those healthcare professionals into our facilities in the event that that we needed to do so. So had a lot of excuse me questions currently and recently around our bed capacity, ventilators, what types of patients can we care for, what's our preparedness. So I really wanted to focus our conversations around that for this community here to really provide you with some in-depth knowledge based on what our planning model is, and to reassure you that in the event that we did see a surge, we would have been prepared to manage that population coming into our hospital.
Wonderful. Thank you, Shelby. Dr. Heineman, anything to add on to that or possibly tag on to our Sioux Falls Hospital and how we would manage those patients in Windom?
Sure, Carly. As Shelby has outlined, we've been partnering with our outlying partners since March in developing a surge plan that included all of our partners and looking at where would the patients be best cared for and how could we best utilize the expertise and the staffs in our critical access hospitals. Critical access hospitals have always been kind of that first line of defense, if you will, for communities. It's where they're evaluated. That's where they're seen to see if they need additional care needs. And so it's really, they're vital to rural healthcare. And that's why it's really important that we partner and understand how we can best support each other and how we can best utilize the skills and talents and resources available in each one of those facilities. So this has been good. Shelby's been part of our calls. We have an awful lot of planning calls. I think we have one every day. So I'm comfortable that we are as prepared as we can be to meet the needs of our patients if we get this significant surge.
Okay, we're going to tag along to Josh Sammons and Dr. Youssef, who are going to speak on behalf of a few things from our local Windom clinic.
Good afternoon. This is Josh. I'm just going to kind of build off of what Dr. Heineman had and what Shelby had, but kind of more look at our clinic level and what we're doing to continue with our patient care. And I know many of Sanford sites and the hospital and so forth are continuing to hit a lot of these things of making sure the correct PPE are utilized. We take our guidance from our Sanford leadership as this changes on a day-to-day, week-to-week basis of what is required, not just for our providers, our staff, but also for patients. We're making sure that we're keeping up on the newest and latest and greatest direction that we've been given, making sure that we're continuing to disinfect areas, utilizing online check-in, and continue to kind of restructure our clinic hours in an attempt to continue with this care. And that is one of the areas that I think is very important, is that we all know that COVID-19 is occurring, and it's changed many things. But we need to continue to provide care to conditions that may not be COVID related. Wellness exams, immunizations, and we're trying to capture that and find out a way to keep our population, patients, staff, and everybody safe. And I think we've done a very nice job of this. If you want to go to the next slide, with a lot of these e-visits, televideo visits, which at Sanford we utilize MyChart. MyChart is a communication tool between a patient, nursing provider that has a chart. There may be encounters that are messages that go back and forth, but past month we've really stepped this up and have been able to do a MyChart visit, which a lot of times these in the past have gone out to Sioux Falls and been managed that way, which within the last month, our own providers, in which you can see our clinic hours are there, our own providers are able to perform these MyChart visits in-house during these hours as well. What that does is that cuts down that risk of that patient coming into our clinic. Even if we have safety measures that are taken that may help decrease any of that contact that needs to be, if these visits can be effectively managed through televideo. Along with the MyChart visits, if somebody does not have that signed up, we have been able to utilize iPads and use other operating systems. DocSeeMe is one. FaceTime is one that all of our providers have their own iPad in which we're able to communicate with that patient. If at all costs, if that patient does not have some video device or a phone that is able to communicate, we occasionally can do a verbal visit, which is meeting with the patient and the provider, talking about what direction that they need to go with their care. What we've continued to do, and along with that, is doing in-person visits with a separation of our visits. We're trying to do, like I kind of mentioned, our wellness exams, immunizations, things of that nature that somebody may not be sick but needs to have that care to continue. We're separating those with those being seen in the morning. So our cleaning crew has gone through the night, cleaned everything completely, and we're trying to keep those sick visits till later on in the afternoon. So just trying to reassure our community, our patients that yes, we are cleaning throughout the day, but if we can do that separation of visits with those well visits in the morning and the sick patients in the afternoon. Just to kind of build off of that, I know that we've talked about our testing, and what we've come up with is not kind of a drive-through, but more of a curbside testings, to where that visit may be done if that provider has performed that telemed video visit and we have deemed this person that needs to be tested for COVID-19, those people aren't going to see our clinic. They're not going to walk through the doors. They're actually going to drive up behind our clinic, and we're going to have our nursing and lab staff collect that sample. So where that decreases any risk of having somebody with COVID-19 in our clinic, we're going to be able to keep them out. And that's just adding to that separation, which we've seen as a very positive thing. One of the areas in which we've done this is grouping these, in order to conserve that PPE, we may group this testing at like about 3 o'clock in the afternoon. Our courier will take those samples shortly after that, but if we have 5 or 6, 7 people that are lined up, we can conserve that PPE. We can get all those samples taken and get those sent off in the courier. So just want to reassure the community that this is how we're doing that gathering that test. keeping our clinic clean because of that. So as far as testing goes, you can see this. You can always contact your primary care provider. Our website, Sanford Health website, the hospital website, and as this slide alludes to, not testing everybody. So when this came out, a lot of times there was limited tests, and what we would look to do is testing that inpatients, long-term care, healthcare professionals. So this is kind of as testing becomes more widespread and there's more testing available, this becomes more of a provider discretion, which we still take our guidance from the CDC and what the Sanford Health guidance is, but just knowing that I think you will see that on a national level, on a state level, and on our own community level, you will see that the testing is becoming more frequently used and more widespread. Last point on this, as many of you know, there are no vaccines or medications that are continued to treat COVID-19 at this time. I think there's a lot of these have been covered, and a lot of these are in the media, and a lot of these are put out there with public health, with our providers, with the hospital. But really reiterating, stay at home if you're sick. Looking to avoid that spread, just like Dr. Heineman alluded to, that 6 feet, and that's very important. That social distancing, as we've all seen, is one of the most important things that we can do to decrease this spread, and practicing good hygiene practices that these should be almost nearly in place every year for when the flu is around, but just making sure that we're sticking to these even more so at this time. Thank you for your time today, and I will look to pass this over to Nancy.
Wonderful. Thanks, Josh.
Hi, this is Nancy, the administrator at Good Samaritan here in town. Just thought I'd try to give a brief update and kind of what our life looks like now here at the center and on our campus. So March 10th, our first precautions were put in place, and within the first 10 to 14 days, several things happened, including closing to visitors, staff masking and using PPE as appropriate, screening employees every shift and screening clients 3 times a day for symptoms. Everything that we do is driven by guidelines and regulations that Good Sam puts out, the Minnesota Department of Health, CMS, and of course the CDC. So we're making sure we stay current, and things change weekly, if not daily, for us on different guidelines. 2 weeks ago, we had our first staff exposure. This person was exposed outside of work and is now actually just returning to work after 14 days of quarantine. We have had other staff and clients that we have tested based on our daily screenings, but all the rest have been negative. Access to supplies has been stabilizing. That was really quite a concern in the beginning, the first few weeks. However, now we've been informed that some food items may become more challenging to obtain, as most of us probably know with the changes in the ag industry. So we're watching that closely and working with our suppliers. The residents' daily life looks a little bit different, as we can't do communal activities anymore or communal dining. So client activities and socialization has changed significantly. We now do hallway activities where they sit in the doorways of their rooms and can do things and see their neighbors. We do lots of one-to-one visits with various staff members, completing those with the clients. So they get touch points at least 3 times or more a day, each resident, just with activities. That doesn't include all the care and that they receive. Family visits now are virtual with iPads that we purchased. We also use iPads for some telemedicine visits, which has been nice, as then the client doesn't have to leave the building. And then most of our clients dine in their rooms unless safety prohibits it. Again, really working on that 6 feet social distancing and just trying to keep people as safe as possible as we can. So that's kind of what our days look like now at the center. And Mickelson and Remick and Sogi.
Thank you, Nancy. I think it's just good for people to hear that things are okay. I know that's a scary thought. I know a lot of us have loved ones, family, friends in facilities such as the Good Samaritan Society or others. And that is obviously a more vulnerable population. And so I appreciate you speaking to some of those fears, that you're taking the efforts as much as possible to keep those individuals safe. So thank you so much.
Yeah.
And lastly, we have Steve and Tim from the city, and not sure if there's more. I got your quick chat there, Steve. So to touch on a few things that they are doing, or updates within the city of Windom too. Thought this would be a good platform to share since we have quite a few community members on.
Thank you, Carly. Steve Nasby, City of Windom. Thanks to Sanford and Winterberry Health putting this together. I think it's very informative for people and glad to participate. Just wanted to let everyone know that, you know, the city has been in communication and coordination with all the efforts that are going on. That's kind of our role in this. We talk a couple of times a week to the Des Moines Valley Department of Health and folks. We also have our emergency management people in Windom. Dan Ortman is the city's emergency management director, and Paul Johnson is the Cottonwood County director. And so they're in touch with the state emergency operations office in St. Paul. And so we're getting information and daily updates from them, and that come through. So that's how we're kind of keeping on top of things. We are trying to post executive orders and other COVID information on the city's website. It's right there on the front page of the website for City of Windom. So if you are interested in more information, you can go there. As I mentioned, we have coordination with our health providers, certainly with Sanford, Winterberry Health. We have Avera in the community and other healthcare providers. We coordinate activities with them. Windom Ambulance is continuing to do all of their duties and runs, and I'll turn it to Tim real quick. Surprise there, Tim, toward the end here, just if you want to add anything, but they're continuing to do their activities. They've got their PPE and everything that they're using for those runs. The dispatch will call for screening. So if someone calls in for a run, the dispatchers will ask about COVID symptoms. So the ambulance crew has an idea there. So we're hoping that they all keep safe and have the equipment they need. As far as city functions, the city had, back when the first executive order was issued to shelter at home, the city hall, the community center, the library, and the arena were closed to the public. That was to limit COVID exposure, not only our employees, but to the general public. Those facilities are open. Staff is here working. So if you have questions, you can always call City Hall, call Community Center, Library, Arena. We also do, we're online. We all have emails and city website with information on it. As of Monday, the library is starting to do a curbside service. The library will now take your phone call or email, get books for you, and then arrange a time to set them out and then a time to return them. And then so there's safe protocols that they're putting in place for that service. The liquor store was deemed an essential service by the state, and so that has been open throughout. There are conditions on that where we are trying to safeguard the patrons as well as our staff. They have instituted kind of the plexiglass barriers, and they do a lot of sanitizing every single day down there. And then we also have a limit on the number of people that can be in the building at one time at 5. There's been some reduction of hours, but I think we're going to expand those back out. I want to talk about utility bills for a moment. The city did go ahead and waive late fees for people through the 31st of May. We also suspended our utility shutoffs for the 31st of May. We did that so that people struggling with some of their bills during this COVID epidemic could, get a little bit of a break on those utilities. But the utilities, I still want to remind people, utilities still do need to be paid. So once the peacetime emergency is lifted, we'll go back to our normal procedure. And then lastly, we talked a lot about Tuesday night about advocating for our small businesses. There's a lot of businesses in town that have been allowed to open, but a lot of them are still closed. And we're working on trying to get those businesses open. We're asking the state to, look at that method and how they're turning the dial to allow some of these small businesses to open safely. A lot of them already have safety plans in place, but we'd like to see them open. And certainly with, people in town, as a customer, you shop where you feel safe. That's certainly a personal choice, and, take the precautions that you deem as necessary. So that's kind of what we're doing here at the city. We are still conducting our meetings, boards, commissions, city council meetings. We're doing those online, and those are open and available to the public for participation and viewing. So wanted to assure you that the main tenets of government are still moving along. So I guess at this point, maybe if Tim has something to say, I'll let him jump in. Otherwise, I'll turn it back to Carly.
Sure. Just let the community know that your ambulance service has been updated, protocols, procedures for all COVID transports, and that's done in accordance with the EMSRB, the CDC, and of course our medical director here in town. As Steve mentioned, somebody calls 911, the dispatchers have screening questions, been doing an excellent job. And then of course, when we show up on scene, we also follow up with our screening questions. Patients will be asked to wear a mask. And then of course the EMTs, they're going to be donned in their needed PPE for that call. All of our PPE supply, it's adequate at this time. After each call, the rigs are disinfected from the driver's compartment to the patient compartment to any equipment that's used. So everything is clean and disinfected for the next run. As the ambulance director, I'm kept up with information of any changes, protocols, procedures, updates. Shelby's been really good sending those out to me for what Sanford and the hospital's been doing. I get updates from the CDC, Minnesota Department of Health. Twice a week, I'm on Zoom meetings, either with the Des Moines Valley Health and Human Services or our regional EMS COVID huddle, they call it. And then I pass along information to my crew. Communication's been great with the hospital, the ED department. Some of you may know there's 2 ambulance bays out at the hospital, garage bays. One of the bays is set up as a COVID station. So when we transport or get called there to do a hospital-to-hospital transport, they let us know whether we can enter the garage or we load or unload outside, just to keep everybody more safe. So that's what I got.
Wonderful. Great update, Steve and Tim, and I really appreciate you hopping on. Again, I think this is a good forum for us to show that we're all in this together, and it's all of our responsibilities to make sure people are safe and sound and happy and healthy. We're a bit ahead of schedule, which never happens. So I don't know how comfortable everyone is with the WebEx technology, but I can take a couple questions, have time for a few. And if you scroll over my photo, you can see that there's a little chat box. I can try to answer a couple if anybody is interested. I will say, as I wait for a few questions, I heard an alarming stat the other day. It's specific to our Fargo region, but I think it speaks overall for the health of individuals. In our Fargo area, typically they diagnose about 8 women or patients a week with breast cancer diagnoses. And over the last month or so, that has almost been eliminated to 0 patients. And that just really goes to show that they're putting up their preventative care, which is really scary. There's life and things that need to go on outside of COVID-19, and that's, you know, your preventative screenings and maintenance and your colonoscopies, and Josh alluded to immunizations and all those things. So I think that's so important to be mindful of. And so I don't know if Josh, Dan, or Shelby have anything to add to that, but I think that's such an important thing to be mindful of.
I'm sure Dr. Heineman could speak to this a little bit better than I could, but just seeing that, you know, legislation that's coming out and opening that back up right now for non-essential procedures. I know that it's going to go depending on the anesthesia, but just knowing that things are starting to open up a little bit, and I think that's very, very important because
Thanks, Josh.
and
I think what the community needs to understand is that as we open up and start doing more routine care, we also have the responsibility to make sure we have enough protective equipment on board in case something were to happen or cases started to surge again. And we have enough protective equipment to make sure that the care that we provide is safe for our employees. But Carly's absolutely right. There will be other consequences to this COVID-19 pandemic related to other illnesses and diseases, cancers, and a variety of other things that will happen to our communities, the patients who live in our communities, if we don't get started getting back to the business of taking care of all of our health needs. So that's why this is really important. And even though we might get through a surge of COVID-19, until we get either really good treatments or a vaccine, this virus is going to be with us, and we need to learn how to provide care in the face of this virus still being there. And how do we do that effectively, efficiently, and more importantly, safely?
Thank you.
And Carly, this is Shelby, I would like to just emphasize as well too, as the stay-at-home order is lifted and as we are able to open back up and introduce more of our services and get back more into a new normal, I just want to reemphasize that that will not eliminate the precautions and screening tools and the safety measures that we've already currently put in place here at the hospital, at least not immediately. So I just want to emphasize that as these stay-at-home orders lift, that's not going to remove the safety precautions that we have in place here at the hospital.
Thanks, Shelby. I did get a question asking what the hospital is doing specifically for efforts to protect patients so they can feel comfortable when they come for their outreach visits.
Sure. We have a process to screen not only, I'll speak with staff safety first, because I think that goes in hand with patient safety. We do extensively screen our staff prior to every shift that they come into work, and monitor them throughout their shift, and have a procedure in place if they're starting to feel ill or symptomatic or what have you. As far as for patients, we also have those screening mechanisms. We are asking that patients do not enter, patients or staff actually, do not enter the building without a mask on. If they're not able to, if they don't own a mask, that one will be provided for them to wear as they're in our building. We will continue to keep visitor restrictions in place as well too. Again, it's vitally important that we remove our risk as much as possible, which would make the patients that are here within our organization, or should make them feel safer also. We have rearranged our seating areas to where it is, we still continue to practice the social distancing and deter individuals from getting too close, following those measures, not allowing any minors who don't have that aren't seeking medical care into our building. Our cafeteria will continue to remain closed to the public so that we're reducing the traffic into our area and control it a little bit more. So again, those safety measures that we've put in place today, even as things are lifted, will not be lifting anytime soon for our facility.
Wonderful. Thank you for going into that. Another question is just asking for comment on behalf of Sanford on the approach that South Dakota versus Minnesota has taken regarding stay-at-home orders. I can speak a little bit to this, and I might cue Dr. Heineman as well, but obviously very big differences between state to state and how they're managing those efforts. Really, the whole purpose of social distancing, again, is to flatten that curve so we don't overwhelm our hospitals and the caretakers that we need. The big part of that is we can't stop this virus. We can't stop it. All we can do is slow the spread. But stay-at-home orders definitely. So you have to think about the economic impact and places there too. So there's a lot of people and individuals that rely on income and things of that nature. So we haven't necessarily embraced the full stay-at-home order. We do fully embrace the social distancing, the washing your hands, and that piece. But at the end of the day, Sanford feels prepared based on the current projection models of how the surge that we will see. And that is also building in that people are not having a stay-at-home order. Now, when people start to go back, we'll see that spike and things might have to be reevaluated at that time. But as things currently are, we are prepared for that. Dr. Heineman, I don't know if you want to add to that anymore.
No, I think that you're absolutely correct. But the other thing to remember is that while we might have an opinion related to what's best for the health of the communities, we understand that we're not necessarily the ones making those decisions, and that we've been, when asked, giving guidance and opinions. And I think we need to figure out how we're going to carry on as normal of a level of activity as possible with this virus still circulating, and sort that out. So I think we're going to get an opportunity to see how this will work here in the next month or so.
Ever changing. It can change day by day, and projections have obviously changed drastically from when this first started to now. That doesn't mean it can't still change going forward. So, and lastly, I don't know if I can necessarily speak to this, or Shelby. Is there any idea how many tests have currently been done in Cottonwood County?
How many total COVID tests?
Correct.
I wouldn't be able to speak to the number of how many total COVID tests, just simply because that would mean we would have to gather information from all 4 clinics, plus us and such. What I can tell you is that we do have clinics that are testing for symptomatic symptoms. I'll just state from the hospital's perspective with that, we do have more tests available to us here than we did when we started, when this pandemic started. However, for our testing, it is exclusive for ED patients who are coming in who are symptomatic and who our medical professionals are suspecting and want to test for COVID. For any of our inpatients, hospital patients, we do not do outpatient COVID testing. We do have 3 clinics here within the community that are doing that and that have the capabilities, and we would encourage our community to, if they feel ill, that they seek out their primary care providers for further care with that. One thing that I do also want to mention with this as well is, it's important for the community to educate yourself on, again, this virus, how it can spread. But it's also important to educate yourself on how you can take self-responsibility for mitigating the exposure to you. So again, I think that there's going to be a varying different opinions of how people feel safe and what they feel safe and what environment they feel safe. And it really does come down to personal choice with abiding by some of those mitigating factors that you've learned about this virus. And again, Dr. Heineman, I don't know if you would like to emphasize, but one point that I wanted to bring forward here as well is not everyone that is infected with COVID is hospitalized, and even smaller number is placed in ICU or vent. So Dr. Heineman, if you can, again, just reemphasize, kind of the numbers and the stats that you had put as a general whole, because I think our human nature is to make our minds go to the worst case scenario, and really keeping this disease in perspective, I think, is going to be vital for us moving forward as well.
Just people need to understand that this virus can be very serious, but the vast majority of people who become infected have a mild case. But I don't want people now to say, "Oh, it's going to be fine. I'm only going to get a mild case." We don't know from individual to individual who will have a mild case and who will have a case requiring hospitalization and/or even ICU care and ventilators. So it is crucial, and it's very important to make sure that we do everything in our powers to avoid exposure to this virus in terms of social distancing or physical distancing, as I like to call it, and then making sure we wash our hands. I don't have my mask on right now because it's at a table right next to me, but when I leave my office and I go out of the door, I need to have a mask on now. When I leave the hospital, I leave my surgical mask here at the hospital, and I wear a cloth mask that my wife has made when I'm home, and I go into the grocery store or the gas station or the local hardware store. I wear a mask in an effort to try to it's not so much that it's protecting me, but I'm protecting the rest of my community by virtue of not trying to spread any virus that I might have. And remember, we're also finding that a significant number of people are asymptomatic or don't have any symptoms and still might shed this virus. So that's why it's always important to look at your environment, look where you are. If you've been touching surfaces, to make sure you wash your hands or use some hand gel and protect yourself.
Wonderful. I don't have any more questions that have come in, but if after this presentation something comes to mind or something didn't get answered that you were hoping to hear today, please email those questions directly to Shelby. She has so kindly taken that on, and we'll be happy to either send them to the appropriate place or answer them on her behalf as well. And her email address you can see on the slide at Shelby.Medina, MEDINA, @sanfordhealth.org. And so she'd be happy to help out with those. Additionally, we will be sending a brief survey out. If you are a registrant of this, you will get that in your email. And really the purpose of that is just to hear if you thought this was helpful, if there was other information you were hoping to hear. And then we have considered also in the Windom area doing a business occupational health presentation through our ACMED department. And so you could check a box if that's something you'd be interested in having. And that's more focused on workplace mitigation and return to work type policies and things like that. And then just a few other questions there, but so that will be coming out optional. If you could please do that, that would be appreciated. And additionally, this presentation is recorded. And so we will be working to get that out to appropriate channels, working with the city as well as the hospital in Sanford to be able to post this so you can share along with those who maybe hadn't heard about it in the short time that we promoted or weren't able to join us today. So we will be sending that out. And otherwise, thank you for joining us. I hope you're all staying safe and happy and really taking care of yourselves. Check in on one another. Say hi to your neighbors, even if it's social distance. We're all in this together, and we're going to need each other to get through this and get over the hump. Life will return eventually, but we will get there. So, all right. Well, thank you everyone so much, and we will be sharing this shortly. Take care.
Thank you.